Thank you very much for the invitation. It's really, really nice to be here with you all. Please, next one. So these are the aspects I will try to cover during my presentation. I will speak a little bit about the HIV epidemic among MSM and transgender women in South America, very briefly, and in Brazil. I will talk about what we have done so far in studies with PrEP in Brazil, and I will then talk about the implementation of PrEP in Brazil. Next one, please. So by the end of 2019, there were around 38 million people living with HIV, with almost 700,000 deaths and estimated 1.7 million new infections per year. 1.7 million new infections happened in 2020, 3 times higher than the UNAIDS 2020 targets. So HIV prevention is a key element for us to focus in our region. Next one, please. So although prevention strategies and treatment options dramatically evolved in the last years, estimates of new infections reached a plateau in our region in South America and remain stable over time. In 2020, 60% of all people living with HIV in South America were living in Brazil, as you can see in this slide. Next one, please. So almost 50,000 new cases of HIV infections were estimated in Brazil in 2020. Next one, please. The HIV epidemic disproportionately affects key populations. So in different countries and in different regions, as you can see in this slide. Previous PrEP studies have shown considerable challenges in maintaining daily use adherence in these populations. So not by chance, these are the same populations that are the most affected by HIV. Next one, please. Brazil has a concentrated HIV epidemic with a prevalence in the general population of 0.4%. The Brazilian HIV epidemic is concentrated among key populations with cisgender men and transgender women who have sex with men, particularly affected. Estimates from among MSM show high HIV prevalence that has increased from 2009 to 2016, as you can see in these slides. These are results from RDS studies that were done in 2 different points in time in 2009 and 2016, and you can see the results of both studies represented in this slide. So trans women bear the highest estimates in the country, and more than 30% of them were living with HIV. Next one, please. As you can see in this graphic, young MSM are among the few populations with increasing numbers of new infections in Brazil, where HIV incidence has stabilized in the overall population. Next one, please. A Brazilian trans-specific study, the Transcender study, was conducted by our group and identified that 31.2% of the trans women assessed were infected by HIV. And also you can see in this slide the importance of the other STIs among trans women in Brazil. So you can see that syphilis is really a very important STI in our country, and you can also see that rectal chlamydia and rectal gonorrhea are important, and unfortunately molecular testing is not available overall in Brazil. No, it isn't. actually available. These are results from a study, and probably in the entire region, molecular testing is still a challenge because of the prices, but it's little by little expanding anyway. But syphilis should be a major focus for us, as the prevalence and the incidence are really high. So results from this study, Transcender, showed that by age 24, and this was really something that was very impressive for us, is that by age 24, 1 in 4 trans women were already infected by HIV. So that was something that was really impactful by the time we saw these results, because this was actually the first large study to assess HIV prevalence in a well-designed study. So young trans women also had the worst prevention practices, such as higher odds of condomless anal sex, as you can see in the slide, and lower PrEP and PrEP awareness at that point. Next one, please. More recently, and this was published this year, we evaluated MSM and transgender women who sought HIV testing at the Evandro Chagas National Institute of Infectious Disease at Fiocruz, where I'm based. And this HIV testing happened between March 2018 and January 2020. And we used the limiting avidity assay, the LAG assay, as part of a recent infection testing algorithm that is called RITA, and was employed to identify recent infections, those with a normalized optical density equal or less than 1.5 in the avidity test, and that met all the criteria as a recent infection. And then we analyzed the annualized HIV incidence. And as you can see, the overall annualized incidence among MSM and trans women who sought HIV testing at our site was 7.35. And then when you look more targeted populations, and when you look among the trans women, this estimated overall annualized incidence rate estimate was 9.16. So as you can see, the epidemic is really far from being under control, and expansion of HIV treatment, HIV testing, that is the gatekeeper for all of this, expansion of HIV testing, expansion of linkage to care and immediate treatment initiation, and also including PEP and PrEP in our strategies, may help us to overcome this severe situation that you can see. Next one, please. So as you can see in this slide, we had several important studies that were rigorously conducted, randomized clinical trials, and in these studies that it all started with IPREX, that the region was highly represented in IPREX with several sites in Peru and also in Brazil, and all these studies saw that in combination with emtricitabine, tenofovir plus emtricitabine is a highly effective combination for HIV prevention across populations and contexts, demonstrating very high levels of protection against HIV infection when used with fidelity, and the margin of forgiveness to non-adherence for rectal protection much more rigorous adherence required to maintain vaginal protection. Next one, please. Other advances in PrEP include the development of a monthly dapivirine ring that is effective against the vaginal HIV acquisition among women, but with much lower levels of protection. And more recently, pre-exposure prophylaxis based on TAF was approved by the FDA in October 2019. So currently, cabotegravir, long-acting cabotegravir is submitted to the FDA as a new option for HIV prevention among MSM, transgender women, and cisgender women based on the results of HBTN 083 and HBTN 084 that were studies conducted to assess the efficacy of cabotegravir LA given as an injection every 8 weeks compared to TDF-FTC among these different populations. And both studies showed superiority of cabotegravir LA compared to TDF-FTC, but with an important point that these studies really enrolled very high-risk individuals. So CAB-LA is not an option to substitute TDF-FTC among those who are doing well with it, but it is actually a new option for those who are really struggling with adherence, and among these niched populations where we see that the HIV epidemic is ramping up, and they are, of course, the same that are not well adapted using oral PrEP. So it's important that we have further options for these individuals who are struggling with a daily oral regimen. Next one, please. So as you can see in this slide, more than 1.3 million PrEP initiations occurred worldwide by the second quarter of 2021. In 2020, South America accounted for only 4% of PrEP initiations worldwide. Recently published WHO data identified that among more than 626,000 PrEP users in 77 countries, 41.6% were in the Americas, but most of them, 90%, in the US. As such, Latin America represented a small number of PrEP users given the huge demand we have in our region. Next one, please. So global cumulative PrEP initiations have increased ninefold in approximately 4 years. Nevertheless, annual proportion of growth in PrEP initiations has gradually slowed over time, and only an 18% increase happened from 2019 to 2020, down from 104% increase between 2017 and 2018. As you can see, South Africa and Kenya were the second and third higher initiators, leading the PrEP expansion in Sub-Saharan Africa, with South Africa recently surpassing 100,000 initiations. Brazil accounts for the vast majority of initiations in our region. It's important to note that the current COVID-19 pandemic poses particular challenges for HIV research, care, and efforts to end the HIV epidemic all over the world. It's really worrisome, though not unrealistic, to project how the diminished accessibility to ART and PrEP for those currently in use and decreased uptake for those in need may act synergistically and possibly even increase HIV transmission beyond what we have already shown in the previous slides. Next one, please. So, as you can see in this slide, randomized trials have demonstrated the safety and effectiveness in HIV PrEP in preventing transmission of the HIV. And this slide summarizes the population level effectiveness of, go back one, please. No, back. Yes. So this slide summarizes the population level effectiveness of scaling up PrEP access on decreasing new cases of HIV in 4 major cities located in high-income countries. Next one, please. So as PrEP moved from clinical trials to implementation as a public policy, obtaining data from developing countries is essential. Next one, please. So to better understand the use of PrEP in contexts such as ours in Brazil, we conducted the PrEP Brazil study that was the first Brazilian PrEP demonstration study. Next one, please. Overall, 74% of the 450 participants enrolled had protective levels consistent with the use of 4 or more doses per week when assessed by the end of the study. Nevertheless, as you can see in the graphics, young men have been one of the groups most of, as you have already seen, that is one of the groups most affected by HIV infection. In our data, we show you can see that PrEP Brazil observed increased rates of loss of follow-up during the project among the participants aged between 18 and 24 years, as you can see in the green parts of these graphics. There were also decreasing rates of participants achieving protective drug concentrations, as you can see in the blue parts of the graphics. This data reinforce that adherence is an important issue among those at high risk. As you can always also see, in PrEP Brazil, we observed that most transgender women had protective drug concentrations for the first half of the study, but around half only maintaining these concentrations after the week 24. So it's important to note that for these populations where we see the epidemic growing in Brazil and also in several countries in our region, they need probably other options that may have that may fit better to their lifestyle. So new technologies are essential to get to the desirable impact on HIV incidence in these groups. Next one, please. As you can see in the extension phase followed, when we followed participants for 2 years, of the 450 initially included, 2,079 stayed for up to 2 years, and young and Black participants had significantly less chance of retention in the study. So even within these populations, you see that also the Black participants had a very significant chance of staying less. And we are seeing in other circumstances, now in PrEP implementation, that Black individuals are the only population that didn't have a major impact, even including PrEP related to HIV prevalence and incidence, And this was seen in São Paulo state, where PrEP has the major number of individuals using PrEP. So unfortunately, the impact of PrEP, even in a program like ours, is not noted among all MSM and trans women, with Black participants having a lower, showing a lower impact on HIV incidence. Next one, please. So in this slide, we wanted to talk a bit about specific trans studies. So few PrEP studies were specifically designed to trans women in the world, especially in low and middle income countries. So to address this gap, our group has designed and implemented the study called Preparadas, that was a 48-week demonstration study to assess PrEP use among trans women engaging in high-risk behavior for HIV acquisition. We enrolled a total number of 130 trans women, out of which 85% were retained at 48 weeks. Participants aged 34 years or less and those who reported stimulant use had higher odds of having a missed visit. The odds of missing a visit also increased after the week 24, as we exactly showed you about PrEP Brazil. We also measured, as in the previous study, the DBS dry blood spot levels for tenofovir and emtricitabine, and at week 24 and 48, and showed that high PrEP adherence decreased and low PrEP adherence increased over time. Low PrEP adherence was higher among Black trans women and those with low schooling. So participants using the feminizing hormone therapy that we made available at the site for this, that we make available at our site for trans women, and these trans women using feminized hormone therapy had decreased odds of low PrEP adherence. These results point that although high PrEP retention can be achieved in a gender-affirming setting, PrEP adherence may be an important challenge faced among trans women due to social disparities. Next one, please. And now I will very, very briefly talk about IMPREP, as Kalika already talked a lot more about this study. I just wanted to point out that this is a large demonstration study, as Kalika already presented, to assess preparedness for the rollout of effective HIV prevention among key affected populations in Brazil, Peru, and Mexico. And this is a large study funded by UNITAID and coordinated by Fiocruz. Next one, please. And in the data that we recently, next one, please. Can you pass the next slide, please? Data recently presented at IAS 2021 showed important discrepancies, even among the countries in our region, with early and long-term continuation and adherence measured through lower medication possession rates and higher HIV incidence in Peru. Very importantly, transgender women presented worse outcomes than MSM in all countries. Next one, please. Other IMPREP data that was presented by Carlos Cáceres in IAS 2021 showed a higher risk of seroconversion among young individuals, those who reported receptive anal sex without a condom, and those who had low adherence levels, and also among those that were living in Peru. Next one, please. So now moving to implementation, what is being done, particularly in Brazil, current PrEP indications in Brazil focus on key population groups, including MSM and trans women engaging in riskier behaviors such as condomless anal or vaginal sex, recurrent STIs, and repeated PrEP use. So we also can use PrEP for cisgender women or in that have HIV positive partners, and also it's also open for serodiscordant couples. Next one, please. and just to complement that, can you go back 1 second for the last slide? These are the guidelines that are published to guide PrEP use in our country. Next one, please. So, as you can see in this slide, the impact of COVID-19 in HIV care and prevention has been a concern in our country. And the COVID-19 pandemic dramatically impacted our country and our region, as you all know. And nevertheless, the Brazilian national data did not observe reductions on new PrEP users and the overall users in 2020 and 2021. But unfortunately, the level of use is quite low compared with the projections we had of uptake of PrEP in Brazil. So we now have around 24,000 people currently using PrEP in Brazil, but the initial projections we had with mathematical modeling showed us that in the first year, we would have around 60,000 people who would be using PrEP after it was made available. So we are far from getting to the level of uptake that we should get in Brazil. Next one, please. Next one, please. And so, as you can see in this slide, Brazilian national data also shows important inequalities in PrEP access. The great majority of users are highly educated MSM and more than white and aged more than 30 years old. We also observe that PrEP interruptions are more common among trans people, which may pose more vulnerable people at higher risk, especially in the critical context of the COVID-19 era. Next one, please. While individual level risks are necessary for the spread of HIV infection, they are insufficient to explain population level epidemic dynamics. In fact, it's the interplay of several levels of HIV risks that can help explain the dynamics of the HIV epidemic among MSM and trans women. To better understand the dynamics of an HIV epidemic, it's critical that we acknowledge the higher order social and structural levels of risk that likely facilitate HIV transmission on a populational level. Next one. So behavioral risk factors only tell part of the story about how vulnerable populations are exposed to STIs and HIV. It's highly important for us to look at stigma. Stigma has been described as a central mechanism increasing HIV vulnerability among MSM and trans women, all of whom violate societal expectations of gender roles and sexual behaviors, and often experience homophobia and transphobia. Next one, please. Inequalities are also a major driver of the HIV epidemic, and the gaps in HIV responses and resulting HIV infections and AIDS-related deaths lie upon incredible lines of inequalities. Racial and socioeconomic disparities substantially impact HIV prevention and care. And the recent UNAIDS report has highlighted the importance of addressing the social determinants of health and vulnerability in the AIDS response. Next one, please. Next one, yeah. Historically, the introduction of evidence-based technologies into public health programs has been fraught with delays that result in missed opportunities for impact. These delays have part being due to the lack of preparatory evidence critical for the introduction into programs at scale. And the IMPREP study is a real task force to look at it more in depth in 3 of our countries in the region. And also, we always face issues related to product registration timelines, which in low and middle income countries are usually longer and sometimes never occur. As such, biological aspects and medical advances are certainly important to address the HIV epidemic. However, these strategies won't be sufficient to tackle the HIV epidemic without addressing social and economical aspects, building political commitment, engaging communities, mobilizing sectors beyond health, and grounding responses in the principles of human rights and equality. Regardless of effective care or prevention strategies, the response against the HIV epidemic is not merely the pursuit of purely biomedical solutions. We need a broader vision, one that encompasses the multiple and entangled aspects of HIV infection and people's vulnerabilities. Let's keep our hopes and thought towards that. Next one, please. I would like to thank all the people that contributed to this presentation, also the teams that worked and are working with us in the different projects, especially in the IMPREP study. Thank you very much.